Today we are reacting to Ted Lasso and his relationship with the sports team therapist in the show.
How long these little chats you do take?
Sessions typically last 50 minutes.
But you charge by the hour, right?
That's correct. Take it you're not a fan of this kind of work.
All Ted was asking right now were the rules of the session and how much the session would cost. I think it's interesting that Dr. Sharon said, I take it you're not a fan of my work. It was not something that Ted was explicitly saying, essentially, and so do you want to be as confrontational, perhaps, as Dr. Sharon was just now? If you can sense that somebody is putting up a wall because they're feeling extremely guarded or embarrassed, or obviously vulnerable in therapy, maybe kind of saying, those are the rules, yes, thank you so much for clarifying, we should definitely talk about that. What other questions do you have about therapy?
Why is that, do you think?
You want the truth?
I'm only interested in the truth, Ted.
Because I think it's bullshit. You don't know me. We don't have history. And yet you just expect me to spill my guts about all the gory details of my life. Fights, mistakes, my deep dark secrets.
Ted is extremely right in saying this, that we expect patients and clients to walk into our office, a place where we obviously feel really comfortable and safe, and spill their guts, is what Ted said. Now, managing expectations is really important for you as a provider and therapist, as well as when you're in the other seat as a patient. Sometimes patients are going to come in saying, I really want to focus on all these, I have all these goals, they've been maybe waiting months or years to get to you. And then the therapist really wants to be effective, and they might feel pressured from the patient coming with all of their expectations to also be able to solve all their problems or issues or obtain their goals in that first session. That is a lot for both of them to really figure out initially. If there was any hesitancy about going to therapy or feeling like therapy is not something that they were open to necessarily, they felt dragged there, they don't believe in it, then it is important to definitely have that conversation. Where did they hear it from? We tend to have a lot of stigma in society, and we might internalize these things. And there's a lot of assumptions about what I do for a living that I've gotten comments about, that I hear often, that we can definitely talk about on this channel. Making sure that we're not spreading the stigma is really a huge goal of mine on my channel.
You ain't listening because you care about me. You ain't listening to me because you paid to listen to me. You're getting paid to just jot down your little notes, diagnose my tears, probably just blame it on my folks, right? You're only interested in the truth. Yet here you are, charging an hourly rate for only 50 minutes of work. Like I said, it's bullshit.
This part, I'm going to talk more about his affect and how we might all respond when we're feeling backed into a corner. He definitely walked into her office. It wasn't like she cornered him, but he was extremely agitated from the very beginning. And this is probably the angriest that we've ever seen Ted, Mr. Jovial Ted Lasso, right? You can see that he's definitely feeling threatened and uncomfortable. What I challenge everybody to think about is what they look like when they're scared. A lot of people would label that emotion as angry, whereas I would say that he was scared or fearful, maybe just anxious, just all of those kinds of things. And I wonder if you ever come off looking angry on the outside when on the inside you're actually just scared.
Ted, you scared me. Are you okay?
I want to make an appointment.
This is after Ted has a massive panic attack. It's not the first panic attack of the season that they show you. I don't know how long he's struggled with panic attacks, but panic disorder is pretty terrible. As a reminder, here are some of the symptoms that you might experience when you have a panic attack. Numbness in their fingers or toes or anywhere in their body, feeling disconnected from their personal body also, feeling like they're walking around and things aren't real. So kind of foggy, not able to concentrate. They could also be extremely nauseous, feel like they're going to throw up. Anxiety and panic can definitely feel extremely somatic, and by somatic I mean that it comes with a lot of physical symptoms. I'll put the video that I did in the eye above, talking about panic attacks using Iron Man and a character from This Is Us. You or somebody you might know might have required or needed, would have benefited from therapy a long time ago. Unfortunately, rock bottom is different for everybody, and so here I think Ted is finally realizing that he needs help. The best kind of treatment is when the patient is obviously bringing themselves to you. I wish that more people realized that they could utilize therapy before things were at a catastrophic state. What that means is that a lot of people that are walking through your door have been sitting on symptoms for a really long time, and unfortunately that means that you have to definitely get to work, and they might be a little bit more acute. You often find yourself wishing that they walked through your door years before, and that's partly why I chose to do child psychiatry, because I was treating a lot of adults and wondering and wishing if I had just met them decades before, what their life could have looked like. Now that I am a child psychiatrist, because mental illness and mental health treatment could span generations, I get to see the benefit of what mental health treatment looks like when you start in a younger age. You get to subtract a lot of years of distress. This goes for the family as well. When I treat their child, I think a lot of parents often tell me that they had similar experiences or similar symptoms when they were young, and just because they're adults now doesn't mean that they can't benefit from the skills I'm teaching their child in adulthood.